Great. And we're letting, hello, Chef Hank. Come
Hey,
in the house.
Chef.
We have,
Hello, everybody. Happy New Year and good things to come.
that's right. There's my alarm going off. Oh, goodness. I think we still have people rolling in. I'm going to disclose I'm sitting at Northside Gwinnett in a waiting area. So if you hear noise and elevator sounds, it's because I have background noise today. So sorry about that.
Can't hear it at all.
Good, good, good.
I was just thinking you looked cold.
Yes.
You're all bundled up.
I was
have been
thinking, are you outside?
I have been cold in the room where I am assigned, that's for sure. I've been layered up today, but it's a little bit warm up here. All right, it's 4:03. I think we're gonna rock and roll. And
Michael here?
oh, is your guest here? If
I
not,
am.
we're gonna. Oh, all right. So welcome everyone. We've been sort of chatting on the side. It's the first all call from 2025. I can hardly believe that's rolling off my tongue, and we're 1/12 of the way through because it's January 27th. So really glad for all of you to be here. Thank you. It's a full house today and it's growing. And this is our just monthly call to come together and share information and to help connect nonprofits in the community to be more effective, more efficient, and do the work for the community and our residents in a more impactful way. So I know you probably got the announcement last week about our guest speakers, and I think we're going to actually begin with Michael Giglio of Giving Health. And I want to turn this over to Eliza to make that introduction because she discovered Michael and has been building a relationship, and I think she'd be much more effective at making that introduction. In the meantime, please put your name and your organization, maybe your email in the chat or your phone number so folks can connect with you throughout the call, and we'll just get rolling. So Eliza.
Thanks so much, Renee. Many months ago, I actually got the chance to meet Mike virtually. And he gave a great presentation that I thought our friends here in Gwinnett would also like to know all about. Giving Health is the name of Mike's organization. It's a Georgia-based nonprofit providing free medical, free virtual medical and mental health care to low-income, uninsured residents in Georgia. Giving Health currently serves over 2,000 residents in 80 countries across in 80 counties across the state, including over 50 families in Gwinnett County. He may actually have even more up-to-date numbers than that. To learn more, I would encourage you all to go to Giving Health's website. It's www.givinghealth.org. And Michael is on the call with us today to share with us his program. I think I'm going to be running Michael's slides. So if you give me a moment, and Michael, if you'd like to take the mic.
Sure. Thank you so much for the introduction and the invitation to speak. It's a pleasure to meet everyone. I look forward to going into some detail on Giving Health. I've got a couple of slides. There's a lot of content. And while I usually ask folks to go ahead and jump in and ask questions, I think given the time constraints, how about I get through all the slides first, and with the time remaining, we can entertain questions. So with that, I'll go ahead and jump right in. So why don't we go to the next slide, please? All righty. So Giving Health, as was mentioned, we're a Georgia-based nonprofit. We grew out of a pilot program with Good Samaritan Health Center of Atlanta and the Veterans Empowerment Organization, which serves homeless veterans. And the objective was to see if we could help move people into healthcare relationships who previously have been living outside of the healthcare system and weren't engaging Good Sam or the Veterans Empowerment Organization to the degree that they would have hoped or would have liked. So we pushed telemedicine out to the community to see whether or not folks would be receptive. And after a year's worth of piloting in 2018, lessons learned in 2019, we got a thumbs up from all the participants and our partners to go ahead and launch it to the public in 2020, just as COVID was making its presence known in the state. So what are we? We're a nonprofit that provides free statewide access 7 days a week, 24 hours a day to licensed physicians and licensed professional counselors for no cost. I believe we're the only nonprofit in Georgia that's offering this type of access to low-income, uninsured, that's key, populations across the state. Our baseline program is focused on serving routine, common conditions that we all find ourselves dealing with day to day, and we know we need to talk to a doctor, maybe get a prescription to address it. So a very common application of telehealth to address routine common conditions, but we've expanded beyond that, and I'll get into that here shortly. But for the overwhelming majority of needs that most of our members require care for, a common telehealth solution available to all of us, quite frankly, no different from the experience we have in our own health insurance plans. We're offering much the same experience with a whole lot of customer care and other services that I'll get into briefly. So for the foundational program, think of us as virtual urgent care for routine common conditions. What we learned over the course of the pilot and the years that have followed, most of our folks who are leveraging our services have a whole host of non-medical social factors that are also addressing long-term care health outcomes. So we do a lot of work in the social determinants of health. We do a lot of referral work, helping people access housing resources, food resources, et cetera. We're not a provider of those services. We work with all of the various platforms that I suspect many of you are already using to identify community-based organizations that are serving housing needs, food needs, utility needs, et cetera. But we determined our members, our patients needed access to those services as well. So we've built out an arm that does that. Multilingual, the emphasis being on Spanish. We do have translation services available to address other languages, but predominantly Spanish and English. And our staff and some of our providers are very adept at addressing Spanish. When you get into more diverse languages, then we're going to bring in a translation service to help with that. Partner collaboration is key. Nobody knows who Giving Health is. We're still a small organization, so we come alongside community organizations, and we want to be an extension of your program. We don't look to establish ourselves as a third party. We want to come alongside and allow you to tell us how you want this folded into the services you already deliver. Okay. We're leveraging 30 years of private sector telehealth innovation. We're using the same providers that are already serving employer-provided benefit packages, individual health plans in the marketplace, employer-provided benefit packages. From an equity perspective, our clients are getting the exact same access to care that we get as members of health plans. Next slide, please. All righty, so as was mentioned, over 2,000 patients served. We're now in over 90 counties in the state and growing. A lot of detail on this slide. Well, I'm happy, Elise, if you want to share the slide deck with everyone afterwards, give folks more time to review it. By contract, our doctors have to respond to a request to a consultation within 2 hours. Most are responding in an hour or less, so it's very responsive. On the counseling side, we have licensed professional counselors staffing the call-in line, so there's the availability of in-the-moment crisis care. Majority of folks are calling in to establish a relationship with a counselor, so that call-in is really an intake call to assess need. If the individual has a specific counselor that they want to speak with, male, female, a specific race or ethnicity, as an example, we can set that up as well. Those scheduled sessions are typically offered within 3 to 5 business days to start the process, and they'll stay with the same counselor. Again, a quick snapshot of some of the conditions: cold, fever, flu, asthma, sinus infection, urinary tract infection, et cetera, et cetera. On the mental health side, depression, anxiety, stress, parenting, communication, anger management. All those things that the majority of the population is typically looking to access services for, we're going to be able to provide in this program. What this program does not do is serve chronic conditions. We do emergency refills for chronic conditions, do that all the time. There's a limit on that, 2 per 12 months for a specific condition, so folks don't get comfortable using virtual care. They got to go in and get labs done, be seen. by a doc to make sure the meds are working properly, organ function hasn't been adversely impacted for whatever reason, and they're able to continue their script. But we do emergency refills as a matter of practice, not a problem. Not a surprise, DA controlled substances, pain relievers, muscle relaxers, mental health medications. In this program, we're not going to be able to prescribe. We'll get into an expansion of services that will allow us to get into some of that here shortly. We do a lot of survey. Year over year, we find this essentially the same results. Well over a half of the folks who use our service stay out of the emergency room, out of the urgent care. Routinely 94, 96, 98% patient satisfaction with the quality of care and the access to care. So we're seeing year over year really good results. We just wrapped up our 2024 annual household survey, exact same results, high patient satisfaction, lots of avoidance of unnecessary ER visits. So we're having, I think, a really good impact on this population. Next slide. All right, what the public health community asked us to do is, hey, we love what you're doing on the urgent care side, but we really want to start looking at ways in which we can move the needle on chronic disease care and management. So we've built out a virtual primary care solution. It took us about a year to build it. We piloted it earlier in 2024 with about 100 folks that we followed through the process. And we're seeing really good results there. So what is this program? We're providing folks access to a primary care physician. We facilitate that primary care relationship by paying for the wellness panel and biometrics. We pick up the cost for the wellness screening, follow-up routine care, and then we'll come alongside folks and be their advocate if there's a need for specialty referrals. No surprise in this population, folks have been living outside of preventative care, primary care for quite a while. So out of range labs are very common. Other conditions that they're either aware of, had already had diagnosed previously, but didn't have the resources to continue to manage, or they've been exhibiting symptoms for years and haven't had a chance to go after it. Well, that's the journey we're starting with them. And we'll come alongside and working with financial assistance programs through Grady, Northside, and others. We'll move them into specialty care and additional diagnostic screenings, et cetera, to help them move forward with their overall health and wellness. We also wrap around urgent care around that. So after hours, you'll still be able to talk to a doctor. We wrap counseling around that. We're doing a lot of work outside of the Atlanta metro area with community service boards on the mental health side because of some of the complexity of the mental health needs that are being identified in this program. But again, inside of the metro area, there are a number of health systems that were able to leverage their financial assistance programs to move folks through it. And of course, we're still doing social determinants of health advocacy and referrals for those services too. Medication, whether it's this program or the baseline urgent care program, we've got a discount card built into the program. This is the one part of our program we can't afford to pay for everybody's prescriptions. So we're going to set them up with a discount card. If there is an expensive brand medication, we'll work to help them submit the prescription assistance documentation for those programs. There's a really nice nonprofit called The Good Pill. It's a nonprofit mail order pharmacy that for $6 can provide 3 months of routine generics medications for chronic conditions. So they're a nice service. So we'll work really hard to help folks find affordable medications. Again, part of our survey, we asked folks, hey, did you get a prescription in our system? And if you did, could you afford it? Well, over 95% of the folks surveyed said they can afford the medications that they were offered in the program, which is great. In the virtual primary care program, we can actually get into that first line of SSRIs and SNRIs for mental health. So we are able to prescribe some of the more common mental health medications for anxiety and depression in this part of the program. So it does expand our envelope a little bit. Next slide, please. And we're getting towards the end. Again, social determinants of health. You know, the primary care community has known this for years. There's been a ton of studies on this. Primary care docs seeing the same clients year over year over year, not seeing a lot of progress in their long-term health and wellness. Well, why is that? Well, they're dealing with a ton of stressors associated with income insecurity, housing insecurity, food insecurity, and the like. So there's been a deliberate effort to better understand and help people access those non-medical social services that are necessary to help stabilize and help people move through those stressors and hopefully over time improve their long-term health and well-being. So we've got a part of the team that does that. We've got some staff that help us with it, some volunteer health advocates that help us through it as well. A lot of work with community-based organizations using Find Help, Unite Us, and our own growing list of services providers, including United Way. We'll access their site as well. Next slide, please. All right, last one. Our objective is to make this as easy as possible. We know everybody is super busy. We're not looking for anyone to take on an undue burden to deliver this service to their clients. And again, we're not going to come in as a third party. We're going to come in under your guidance, your supervision, your preference for how you want the program delivered. In our perfect world, we'll give you some basic information about the programs. Whoever is in the front of the office meeting with your clients is very comfortable introducing the service. And from that point, it's up to you to decide how active you want to be. I've got some clients that are some partners who are very collected with their clients. They're not comfortable handing them off. I've trained them up on how to register and enroll their members, and we provide more of a think of us as kind of back office support, quality assurance, data collection, analysis, and reporting, but they really run the introduction and the enrollments. Truth be told, though, the majority don't have the time to do that, so we take on all of that. We simply ask that you be a good advocate in introducing the program to your clients. Again, no one knows who Giving Health is, so the more you can advocate, the better, and the more comfortable your clients will be enrolling. In terms of who's eligible, 2 eligibility criteria. Income for the household, 200% or below federal poverty level, no health insurance. Those are the only 2 criteria. We have a lot of blended households where maybe mom or dad don't have health insurance, kids are on Medicaid or Peach Care for Kids. That's fine. We serve blended families like that all the time. We want to definitely collaborate with you on how to engage your clients. So we'll talk to you about what a marketing strategy might be, or an informational strategy might be to get the word out and get people engaged. And we'll take care of client registration. We've got a ton of different tools to get people registered. We then take it from there, get them enrolled, train them up on the program, and then we monitor their journey through their use of the different services. So we do all the onboarding customer service. You can be as active as you want to be. And all infrastructure has been in place for several years, supporting utilization. Again, lots of surveying as well to demonstrate that we're having a positive impact. Our services are easy to use and people are really happy to be part of it. So that's it. Went kind of fast. Sorry about that. Any questions?
Yeah, that's fantastic. So I did upload Michael's presentation into the chat, so feel free to grab that and download it for your personal use and your organization's use. Who has a question? Just come off of mute and let's have a dialogue. Michael, you may have been pretty thorough.
Yeah. So it's funny, when we first launched in 2020, 2021, it was a really slow rate of adoption. The principal question we were asked is, this is too good to be true. How the heck are you providing 7x24 resources for free? And it took a couple of steadfast partners who saw the impact on their clients and started standing up and going, we use it, we love it, we'd encourage it. So if anyone wants a referral to one of our partners, you'd feel more comfortable chatting with we work with a lot of clinics. We're with the Georgia Charitable Care Network, or free and charitable clinics. We had about 25, 26 of them use our service as their telemedicine solution for their members. And then we work with food pantries, housing authorities. We work with a ton of organizations across the state. We've also got MOAs with county health departments who act as our lab service provider in many cases. So lots of different ways for us to engage and support the community.
So Michael, there is a question. Oh, go ahead.
I was just going to ask, we're having a health literacy fair, and no doubt there's going to be folks who beat these guidelines. And I'm wondering, is it okay to just print your flyers?
Yeah, sure.
And have them available for folks?
Sure, absolutely.
Fantastic.
You mentioned MOAs, Michael. There's a question in the chat about, is an MOU completed for the partnership between a nonprofit and Giving Health?
Yep, it's a pretty informal letter of agreement, basically frames the services, what our responsibilities, obligations are to you, the few things we need from you to help advocate and get the awareness of the program out there. It's not legalese. It's a couple of pages. As an LOA, it's not a legally binding document. Think of it as a commitment to partner and collaborate to make sure that we're delivering the program effectively.
Thank you. Any other questions for Michael? Such a great resource. I mean, there's for sure a lack of resources for those who are uninsured and underinsured, and this is filling a big gap. And I'm grateful that we came across Giving Health, Michael, and you were able to join us today. If you have additional questions for Michael, are you able to stay on the phone, Michael? You can monitor the chat and respond.
Sure.
Okay.
Quick one. So I
Sure.
think I heard somebody say that it's a link to the presentation, if I'm not mistaken, because I didn't join like at 4, so I missed a few, the few minutes. So
Yep. Are you able to see? There's a link at 4:18 in the chat.
4:18.
Dr. Kubiti.
Okay, so yeah, I see the 4:8. Thank you so much. Thank you.
You're welcome. Let me know if that's not downloadable. All right, going once or twice. Can't see everyone if you have a hand up, so you'll need to come off mute and ask the question, or we're going to roll right into another exciting offering with United Way. All right, our friends Denise and crew need no introduction, but we all know that there is all sorts of opportunity to increase capacity within the nonprofit sector in our community and across the state. And so today, we have Denise and her team and Laura Heiman, who is, I think, lead for capacity building for United Way, to join us and to talk about the program that they have in place and the opportunity for all of you to apply to be part of a cohort and to build your capacity. So Laura, am I turning this over to you, or Denise? Chime in,
Go ahead and
whoever's.
just kick it off. Renee, thank you.
Yeah.
Hello, everybody. I hope that everybody by now has either seen in the exchange, the last newsletter, or from the couple of emails that we've sent out to the masses, hopefully included all of you all, the information about our Gwinnett GAIN program, Generative AI for Nonprofits. We're really excited about this. I think that Laura's got it very well covered. I think I'll just go ahead and hand it over to her. Yes, Laura Heiman. She's the Director of Capacity Building and Operations here with United Way of Greater Atlanta. And so she's one of our colleagues coming out of the Community Engagement Department. Let me just hand it over to you, Laura, and we'll see what questions come up. And if there's anything I can add at the end, I will.
Wonderful. Thank you, Denise. First check, can everyone hear me? Got the nod. Great. I'm always leery whenever I use earbuds. They've turned against me a time or two. But we're really excited to be able to come here and share about the Gwinnett GAIN program. This is Generative AI for Nonprofits. It is a year-long program bringing AI resources and training specifically for a cohort of organizations that are Gwinnett serving. So we're really excited to be able to offer this program, and then we're just going to jump in and share some information about it. I can see a limited view of the folks on the call because I'm in presentation mode. So if there's any hands raised, questions in the chat, if someone else could just interrupt.
I'll be monitoring, Laura.
Wonderful. Thank you, Denise. I'm happy to answer questions as we go along. But sometimes when I get rolling. But yes, let's dive in. So we kind of wanted to start off with, why generative AI? Why are we doing a year-long program on this topic in particular? When, it was just mentioned, there's so many different ways in which we could be building our capacity. Why is it that we're kind of standing behind AI as something that we think is worthy of your time and attention? And so here are just a couple of the things that you're going to be able to do when you become fluent with AI, generative AI. So think about your administrative tasks, streamline, increase time to focus on your strategic and your mission filling activities. Advanced data analytics. We all as nonprofits collect a ton of data, but how we actually leverage that data, both for ourselves and in terms of reporting out to our stakeholders and our funders, I think everyone could say that, yeah, I wish I had more firepower in that part of my organization. Personalized communication with stakeholders, improved program delivery because of our ability to personalize communication both among staff and clients served. Just thinking about your marketing and your fundraising materials, generative AI can really make a huge difference in what those materials look like and how quickly you're able to produce them. Trained chatbots. This is something that I think a lot of folks who have participated in the GAIN program before were like, oh, I don't know if I'm tech savvy enough to want to do a chatbot. But what we found is that you can really be using trained chatbots to answer client FAQs, speed up your intake process on your website. We've actually used it at United Way as a way of our internal information sharing across our various departments. That's one way that we've deployed using a chatbot. More sophisticated grant applications. I don't think I need to say anything else there, but there's a huge way that we could be applying AI. And in fact, there's just some really exciting developments in terms of folks in the field who are training and have been training large language models specifically on grant writing. And so that's also part of the program. And really it can be summed down to it's less time spent on your brain drain tasks and more time actually doing what I'm sure fuels you as a member in the nonprofit field, right? We don't come to this field because we're looking to make a bunch of money and live the luxury yacht lifestyle. There's a reason that we're in this field. And I think that being able to have AI assistance in your everyday, it just allows you to be able to do more with why you're in this position in the first place. So quick facts about this program. It is a year-long AI capacity building program. It's for Gwinnett serving nonprofits, so you don't have to physically be based in Gwinnett, but definitely have a strong presence with Gwinnett serving. And it's going to be running from March 2025 through February 2026. So it is a full 12 months. It is being co-presented by United Way of Greater Atlanta and our partners, NPursuit Career Partners. They are a local woman-owned social enterprise. They are absolutely fantastic. They're a technical implementation partner. They have been running the GAIN program for about a year and a half, going on 2 years now. They've had 150 professionals, both nonprofits and small business leaders, participate in it. And so they've gotten great feedback about what elements are great about the program, what elements needed to be tweaked about the program. And so we at United Way, we've had staff that have also gone through and done the GAIN program. And it really is a fantastic, fantastic curriculum. And the best part is that it's offered at zero cost. So this whole program is supported by the Gwinnett County Nonprofit Capacity Building Grant Program. And so it is a competitive application, but everything is completely at zero cost to participants, and it's about a $5,000 in-kind value to the program. So to go into a little bit more detail about what you would experience throughout the year, every person who participates would receive a Microsoft Copilot Studio license. This is the super duper top of the line Copilot license, which means it's integrated across all of your Microsoft applications. Although we will be diving in and learning about several different types of AI that you can be using, whether that's ChatGPT or Gemini, or I mean, really, once you get into a specialized AI application, there's thousands of them out there that you can use. We will be focusing in on Microsoft Copilot as sort of the main one, but you will learn about and interact with many different types of AI applications. So you'll get the Copilot license. It comes with one-on-one coaching throughout the entire program. It really kicks off with a 9-week intensive lab that runs March through the beginning of May. It's twice a week. But this is where you get really your boot camp of understanding your AI skills, your different applications in terms of, do I want to build a chatbot? Do I want to be building out more of AI automation through Power Automate, or, there's like 110,000 different ways that you could be using AI. So this is where you're getting those actual more data focused skills, but then also going into AI strategy. Is my organization, and how can my organization be better prepared to integrate and roll out AI? What do our policies need to look like? What does our data protection need to look like? Responsible AI and ethics, it'll be another big element that we kind of dive into, so that you can decide as an organization what's the right way that you're adopting and implementing AI, and doing it in a way that adheres to best standards in the field, but also best standards to who we are as nonprofits and our mission to serve the community. So that intensive lab again runs March through about the beginning of May. And then throughout the year after that, we'll be doing some skill deepening workshops. And so we'll come back together 4 more times throughout the year. You'll get still have access to that one-on-one coaching beyond the intensive lab. And then your training portion will kind of wrap up by the end of the calendar year, but you'll have access to the Copilot Studio through the end of February, which makes it that 12-month program. And lots of information on this page, but the kind of timeline is over on our left. So applications are open right now. They close on this Friday, January 31st at 5 p.m. You will be notified by the end of February whether you're accepted into the cohort. And then we really kind of hit the ground running. Our first class is on March 4th. The majority of the intensive lab is in person. We'll be meeting in Gwinnett. And then we'll also be meeting in Gwinnett for the AI skill deepening workshops that happen throughout the year. So it'll be a very Gwinnett-focused, Gwinnett-centric version of the GAIN program, which we're really excited about. I just said a bunch of information very quickly. So if there's any questions that folks have, I'm happy to, take this off the screen, or to go back to another slide and answer any questions you might have about the Gwinnett GAIN program.
I got a question for you.
Sure thing.
The application itself, is that through the United Way Flux?
Wonderful, because I forgot to say this. Thank you, Tim. That was like a plant. But yes, so all applications will be through the United Way Flux portal. If you already have, if you're already set up in Flux and have your organizational profile, we just ask to make sure that your org profile is updated, and then complete the Gwinnett GAIN application. And we have a reference copy that's a PDF. So if you want to see the application, kind of look through it to get a better sense of whether or not you want to apply, or just even what the questions are, we can send that out. But you can also get started on that in Flux right now.
We have a
Do you
question.
have to ask for permission to get the Flux app, to get added to Flux?
If you're not currently in Flux, there is a registration process. So you would request you would request to register your organization. I have a PDF that goes step by step, that goes you through the process. But we can also send that out as if you're not already in Flux, how to go ahead and get registered.
Yes, we'll share that. Question on the chat is, how many organizations are being accepted? We're looking at 20 participants for the program. So 20 organizations to be accepted.
Thank you.
Other questions? Well.
And the deadline is Friday, right?
At 5 p.m. on Friday, yes.
So we have many hours between then and now, or now and then.
Yes,
so
and we're
there's
happy
still
to,
time.
if anybody didn't receive it, with the email messages we sent out the program guide that Laura has shown some excerpts from, but also the Flux guide that she just referenced. If anybody wants to contact us, and Renee, I'm happy to, if anybody follows up after the meeting, to get those materials out to them.
Sure.
And also, too, you had a link in the exchange, last Friday's exchange had a link to the program guide.
It did. And I just plugged in so I can actually just put in the chat. Whoops,
Okay.
right here. Well, I have all sorts of things coming in at the same time.
And I will also put out there that if you have any questions about, trying to figure out who's the right person at my organization to participate in the program or any other follow-up questions like that, please reach out. My email has been all over all the communications for this. I'll throw it in the chat again as well, but please don't hesitate to reach out with any questions. We want you to feel confident in applying and confident in whether or not this is going to be a good fit for your organization, because we recognize that it is a time commitment. I believe in the program 1000%, but I also know that it has to be the right fit. So if you have any questions, please don't hesitate to reach out. I've been answering questions. I've hopped on a call or two, and I'm happy to continue to do that until applications close.
That's great.
And I do see several people that have put their information in the chat. So I will scroll back at the end and get those, and we'll make sure we make that connection.
If Laura, if you want to, you could also sort of upload the presentation here and they could download it and have that as a reference point. I'm not sure if that's easy for you or not, but if you want to send it to me as well, I'm happy to do it. All right, Lisa, you have a question from Diabetes Can Win.
Yes. I saw the link, of course, and clicking on that takes you to the United Way, but they were speaking of an email. If we go into that link, does it give us all the information, or do we need to share our email so that we can get the original email?
I'm happy to send the original email, which has the attachments.
Okay.
It has the general explanation, but then it has the attachment in terms of the program guide, as well as the information for the guide for flux, excuse me, if
Okay.
that's needed.
Yes, thank you. I'll put my information in the chat. Thank you.
I've thrown my email into the chat, so it's right there. I will attempt to upload our program guide so that it's right in the chat as well. We're a Microsoft Teams organization, so I often, whenever I'm in Zoom, I feel like I'm one of those dogs that just has snow boots on for the first time, and I'm like awkwardly walking because I have to figure out this platform, and I'm much more fluent on the other one.
Laura, I think I have the right thing, perhaps uploaded in the chat.
Oh, it's perfect. Yes. Yeah.
Okay.
Oh, yes, that's the guide.
So that might be helpful for some of you who want the details.
Do you have, by chance, Renee, the last message that went out also had the flux guide? I don't know if you're able to refer to that.
Hold on. Let's see.
Because that would give it to everybody right away. They could quickly download.
I was pulling from our exchange document.
Oh, okay.
So I'm sorry. I don't have the United Way
That's
email,
okay.
but
I will check for that.
Okay.
We still have some minutes left on the
We
call.
We do. I found it's a lot easier just to upload here centrally, and then people can take that away rather than us having to follow up. It gets a little complicated.
Great. Thanks so much. I'll check for the guide link. Wow.
Okay. Let me just switch now to, and if you have follow-up questions, of course, you know where to reach Denise and Laura. They've made their information available. They're happy to receive your calls or your texts or emails. And then Kayla, I think you have a brief announcement related to our work, the Coalition's health equity work.
Yes, can everyone hear me?
Yes.
I must say good morning. Good afternoon, everyone. Happy Monday. Hope your week is starting off great. So yes, I just have just some quick just information, resources as it relates to our goals with health equity with CDC. So I'm just going to share my screen to just go over that very briefly. Won't take up too much of your time. Oops. Okay. Can everyone see my screen?
Yes.
Okay. Thank you. Okay. And hopefully everyone can hear me as well. Yeah, so just really quick, I know there has been a lot going on with the bird flu, and then also influenza as well. So I just wanted to share some resources that you all can share to your community or that you can look at as well. So I'll start with the flu. If you don't know, the Department of Public Health has a weekly flu season report. We're now in week 3 with 2025, and this is just number of flu associated deaths or the metro Atlanta area, the outbreak. So that's just the number for this week. Well, for week 3. And then also, I just have an article from 11 Alive that was published a couple of days ago, where it talks about how flu season has peaked and right now, the numbers are pretty high with those who are 25 to 49, but also keeping in mind that 65 and plus are always at a higher risk for the flu virus as well. And then I'll drop that article in the chat if you also just want to read it on your own. And then I mentioned the bird flu going around and wanting our community to stay updated with what is going on or where they can find reliable resources. So if anyone in your community is asking questions, you can let them know that the CDC is monitoring the situation very closely. And right now there is no unusual activity with that. Nationwide, 67 cases, 1 confirmed death. Right now, no U.S. human cases are in the state of Georgia. I think there have been a few with animals, but no human cases in the state of Georgia. And then I just have just a bullet point of those who may be at an increased risk of contracting bird flu. But then also, I just wanted to share where you can go to get more information and also guide your community if they want more information. The American Medical Association has more information. Of course, the CDC, OSHA, Occupational Safety and Health Administration. And then also, if anyone works with children or they work with parents, the American Academy of Pediatrics has a lot of information on how to talk to your kids about what's going on with viral epidemics. And then also, if you are a teacher or again, you work with kids, there's a great resource called Kids Health in the Classroom at kidshealth.org that has like a lot of like classroom activities for elementary all the way to high school age to talk to students about uh, like safety practices from like something as simple as like talking to young kids about like washing your hands or just talking more about how viral outbreaks may make them feel with the older students. So I'll also drop these resources in the chat as well. And I just want to share because I just felt like, they could be really helpful as we talk about of viruses and also still remembering that we are in flu season. So making sure that everyone is getting their vaccine as well. So that's it.
Thanks, Kayla. Okay, what other announcements from our callers? Anything happening in your world?
I'd like to put out an all call to let folks know that we have a health fair going on Wednesday, the 29th. That's just a couple of days away. I'll put the flyers and the social media JPEG up there. Hopefully you all help us bring folks in. We're focusing on the Spanish speaking community. So the entire fair is going to be bilingual. We're going to have everything from a mental health panel discussion that Guide is helping us with. We're going to put on our own health literacy workshop. We're going to have a food demo from Open Hand Atlanta. We're going to have a meditation workshop even, and we've got 27 different partners joining us for this. It's going to be, like I say, Wednesday, January 29th from 9 to till 2 p.m. at Our Lady of the Americas Church. That's in Lilburn, and I'll put all this information in the chat section. And if you wouldn't mind just helping us spread the word, we're hoping to get a few hundred people to join us for this great event. Thanks.
Hey, Elise, that might have gone to me directly. I see some of the stuff that came through, but it looks like it might have been to me. Just double check that. Okay. All right. Any other announcements?
I have a few announcements.
Sure. Hi, Courtney.
Hi, so my name is Courtney Cunningham. I'm the Community Engagement Coordinator for Celestial Motherhood and Baby Boutique. It's a nonprofit organization dedicated to supporting pregnant women and postpartum mothers in our community. We have a few events coming up that I'll share the flyers for in the chat, including our Baby Boutique donation drive from now until March 1st. We have an Unconditional Love Conference coming up on February 22nd that will be having workshops and speakers for parents and couples. And lastly, we have educational classes and support groups year-round for mothers that will be held remotely beginning on February 6th.
Thank you. I love the Baby Boutique. It's a reward system for the moms who participate and increase their skills and their knowledge. So that's fantastic. Any other?
I got one.
No.
Hi,
Okay.
everybody.
Hey, JP.
How's everybody today?
Doing great.
Good. So JP Peters here from Georgia Gwinnett College. I'm the Assistant Director for Student Outreach and Service, and I just wanted to make sure everybody here knew about our GGC Serves Expo, essentially our volunteer fair. We're going to have next week on Wednesday, February 5th here on campus, an opportunity to share resources with our students and also share opportunities to volunteer. I know we have some people on the call that already are signed up, which thank you for those. And if you haven't signed up yet, I'm going to throw in the chat information. If you'd like to sign up, feel free.
JP, I'm not sure you were on at the beginning when Michael was sharing information about Giving Health, but you might want to connect with him because you may have many students, right, who are in need of some of those services, and it might be a great connection for you in terms of the population you serve.
Yeah, I caught the tail end of it, so.
Yeah, that's not a problem. I just wanted you to know. I thought, oh,
of course,
be something you might want to tune into. Any other announcements?
Yes, hi, good afternoon, everyone. This is Adonis Diaz with AmeriGroup. We are, hosting events every month. So I would like to invite the community. We are hosting the cooking demo. This is like a collaboration between AmeriGroup, UGA Extension, and Norcross One Stop. So the cooking demo for the month of February is going to be February the 21st, and I will post the flyer. So it's free for those that come. The first 15 people, they can get the ingredients, and they also are going to learn, a new way to eat healthy. Thank you.
Yep, thank you. I love these events that have the cooking demo and groceries attached because it really connects directly, from the knowledge that you learn to putting into practice and beginning those healthier behaviors. So thanks for sharing that. Let me call on Shannon. Are you interested in making an announcement, Ms. Dr. Hervey?
Okay. Good afternoon, everyone. We wanted you to pull out your calendars and just save the date. I'm going to give you the date of March the 25th. 2025, that is the inaugural Resilient Gwinnett Summit, which is becoming a Resilient Gwinnett. So we have a lot of good things planned for you, and soon we will have some marketing materials that we will get out there, but we wanted you to hear it first so that you can put it on your calendar so that when we come forth with registration, you'll be one of the first to sign up. Again, March the 25th is going to start at 8 o'clock in the morning, and it will go through 1:30 in the afternoon. And just a full day of informative learning and education, and you will walk away knowing more than what you came in with. So we look forward to seeing you there.
Thank you. Lisa, you got one. Is your hand still up from before, possibly?
No, this is a new hand.
Oh, you are right, girl. Get those hands up there.
Yeah. Well, thank you. This is Lisa Graham with Diabetes You Can Win. And I was just hoping when she was saying Resilient Gwinnett, we also have an event in March, but it's on a different day. So we'll be able to participate in that and hopefully those who would like to participate in our event. But March, actually the last Tuesday in March is Diabetes Alert Day. So it's a day that the American Diabetes Association recognizes to, again, just get people more aware and testing for diabetes. But we're going to do a weekend event that Saturday with our collaborative partner, Live Healthy Gwinnett. It will be at the Lilburn Activity Center. I think UGA Extension is just getting around. They'll be with us as well, doing, of course, some cooking demos there. But anyone who's interested, we are just, finalizing, of course, some things with the flyer, but we can share that. It is, focused there on, Spanish speaking individuals, but it'll just be afternoon of course, screenings, the education in Spanish as well as in English. And anyone that would like to join us, we'd love to, of course, have you. And just want you all to know too that we have ongoing diabetes education. We have kicked off quite a few programs with our CDC diabetes prevention program. So we do offer that program, which is a year-long program, which is at no cost to those who are Medicare, for those on Medicare Part B. So again, I will put my information in the chat, and if you're interested in any of those things, please don't hesitate to reach out to us. Thank you.
Thank you, Lisa.
Mm-hmm.
And Corner of Creativity, I think. Oh, great.
Hi, everyone. Happy New Year to you all. How y'all doing?
We're doing great.
Doing well. Good, good, good. So my name is Felicia from Corner of Creativity Foundation. And I wanted to make an announcement as well, too. I was going to wait, but I hear that the March announcements are rolling out. So I said I may as well go ahead and jump in on that. So my event is coming up. And if you guys could save the date, March 29th, we're hosting a fundraiser for the Corner of Creativity Foundation, where we're raising funds for our art walk that's coming up in August as well. So the fundraiser will be at a gallery in downtown Atlanta, of course, but we're actually serving our Gwinnetians and what have you with this whole fundraiser and this whole art walk. So we're gonna have, of course, like little food, gonna have some entertainment, some live auctions, just make it really fun and interactive with the community or what have you. So if you guys are interested in coming out, I sent out some Eventbrite emails maybe earlier this week. I don't know if everyone got it. I probably don't have everyone's email address. But if you're interested, I'll probably get some of these email address out of the chats and go ahead and send some things over to you guys. So you can come out and just have a good night. It'll be from 6 to 10 as well.
All right. Great announcements. Anybody else?
Today, I have one last thing.
Sure.
Just want to reference to people that we put 3 documents in the chat. One is the reference application, a Word document that essentially has so you can preview what the application content is, then also the program guide, and also the Flux new user guide. I'm also just want to say, I had not thought of it because we're focused on GAIN, but I'm getting ready to put a link in the chat that is information about the VITA free tax preparation services that United Way partners with the IRS about. And the link that I'm putting there is to our website that will, covers and gives you links to all of the information. The bottom line is that someone can get free tax preparation services, which means they save that money up to a certain income level. I don't want to misspeak and say what it is, but I think it's something like $64,000. So that can be a great resource for potentially your clients. But then there's also My Free Taxes, a truly free tax software that you can use that has a much higher level in terms of the income limit. So I'm just going to do a post, and surely that will come through now if I did it correctly. There it is. A link to that information. And we have sites in Gwinnett, but then there are also other ways to get those services remotely.
Fantastic.
Denise, if you'd like to, or if you have them, the Spanish or English versions of the VITA postcard, if those are available, we can help distribute them at the upcoming
Fantastic.
health fair.
Yes. Oh, that's fantastic. I will follow up because we do have both of those available.
Great.
Thank you, Lisa.
All right. In our last couple minutes, is there anyone else that wants to come off mute? Share any news, make an announcement, or put anything in the chat? All right. I had put in the chat as well that our next all call is on Monday, February 24th from 4 to 5. If you have ideas for presentations and information that needs to be shared with the broader nonprofit community, we are open to those suggestions. So please let us know. And if there's nobody else that has anything to share, I think we can call it a day and give you a couple minutes back. There are some new messages coming in, so we'll leave it up for a couple minutes as people sign off in case there's anything you want to grab out of the chat. But thanks so much for joining us today, and we'll see you next month.
Thanks, everybody.
Thank you.
Thank you.